So, first thing first, being a doctor was not something that I saw for myself since day one, even if multiple people around me saw it. I saw it. It was like something that I should generally pursue because I was interested by biology, pretty typical pre-med student. And beside of biology, I was really interested. I'm still interested about it as I'm thinking about it now, too much about it. But I'm still interested about learning how the body works and why there's like multiple physiological process throughout the body, within the body, and how they work, and how can you manipulate them in order to get a specific thing. So this is something that I'm generally interested into, and these and other reasons that I cannot really list right now because I'm not really thinking about anything are the reason why that kind of pushed me to medicine and pushed me to being a pre-med. But it was a convoluted path. It was never like a straight path of like, you know what, I'm interested about those things and then I'm gonna go and pursue medicine. But it was like mostly I'm interested about those things, but I really don't think that I'm smart enough. I took some time off, talked to some people, and I was all right. So I think I can do that. Decided that hey, pre-med medicine is something that I really want to do. So therefore, I need to be a pre-med first, and do the whole pre-med extracurriculum activities, and get the letters of recommendations and study for the MCAT, which I was doing at some point, and yada yada yada. So yeah, so that was kind of like my path when it comes to me being interested in medicine or me pursuing medicine. So when it comes to extracurricular activities, the first thing that I did was medical scribe. So I did medical scribe for probably 2 years, maybe a year and a half, close to 2 years. I left because it was not as fulfilling as it used to when you first started, because when you first started, you generally don't know anything about medicine. And it was pretty interesting to me, for me, because it's like those brand new words, things that you've never heard before, or like those things that you used to heard, right? But right now you actually know the meaning behind it. And this was interested at some point, but it just like lost. It just became really mundane, because as a medical scribe, we don't get to do a lot. Like I used to see like the nurses like getting, helping the patient getting ready to see the doctors. That was kind of like the thing that I really wanted to do, like being, hey, I'm gonna help you today, or let me look at your wounds because I was doing wound care. So like these are the things that I really hope that I could have done, but I was not qualified to do so because hey, I'm not a nurse, and that's not one of my positions because I was a medical scribe. My job was pretty much like wait for the doctor to go to the room with doctors because there were multiple of them, multiple, yeah. So you wait until they actually go in the room and you help them take notes. That's pretty much it. But you get to see, which is pretty fine. And I think that's actually one of the reason why, if not the reason why, that I'm heavily interested into wind care, and I considering doing wind care as so like a specialty, if this is something that I can do in the future, and that's something that I hope that I can do, to be honest, because wind care is just different. But it get really nasty, I'm not gonna lie, like the smell, the look of it. But as soon as you get used to it and you're just like seeing the wound like closely, the edge is coming up, like coming together, and you can kind of like see the wound healing. That's like the whole process that made me interested about wound care, and that's one of the reasons why I'm interested about pursuing wound care too, as a nurse. It is crazy, because I used to not see myself as a nurse, and I was like, I will never be able to put up with the bull crap that nurses I have to put up with. But crazy enough, that's the path that I ended up pursuing, or that I'm pursuing right now. Yeah. So reason why I switched from being a pre-med to nursing, pre-med is what I see myself doing on I'll say an ideal world where I have all the resources necessary and I can actually pursue medicine, because I won't have to think about the price, I won't have to think about this and that. So medicine is kind of like the path that I really want to do. But given to the new things that I'm facing right now, so I came to realize that it would have been not as easy as I thought it would have, to be honest. if I go right now and pursue medicine, because I've learned a couple things about me during this. I want to pursue medicine path or journey. And one of the things that I've learned about me was that I do really bad with knowing that I owe people money, and this whole idea of knowing that I own like $300,000, like for example, I'm not telling you that $200,000 is kind of like the general price or the general cost of pursuing medicine, because it might be way much more expensive or less expensive based on your given circumstances. There you go. That's always the word that I was looking for. But yeah, so I've came to realize that I do pretty bad with that, and this is one of the things that I really don't see myself doing for a long time. Like, hey, I'm going to school and then I accumulate debt over time, even if the specialty that I really wanted to pursue could have, helped me pay this thing pretty quick, I guess. But it's just like the way that things are turning right now. It's a lot of paperwork. You do get to see a patient, but you seeing the patient, it's not really up to you. So people are giving you algorithms. People are trying to tell you what kind of medication you have to prescribe, knowing damn well that this regimen that they're trying to make you prescribe is not the regimen that will be very much more effective for the patients that you might be seeing. There's that multiple bull crap that I really don't have. Not well, I'm not gonna say that I really don't have, but I'll say that I really don't see myself dealing with. Funny enough, because I saw myself dealing with it for a really long time, but now I don't. And I'm focusing very much more on, I'll say, following my interests and following things that I'm interested into, even if it's not the main thing I'm interested into, if it kind of makes sense. So I'm one of those people who has like multiple things that they're interested into, multiple things that they really want to pursue. But at the end of the day, it's not because you like something that you necessarily need to have it, or that you necessarily need to try as hard as you can to have it, because even though you like it, it might just not be something right for you. I'm not saying that medicine it's not something right for me, but I'm just saying given the circumstances right now when it comes to cost, politics, and multiple other things that I really don't want to talk about in this video because I'm just not ready for it. So I just decided not to make the switch from, hey, you know what, being a pre-med and being a nurse. And yeah. So to be honest, being a pre-med helped me tremendously on this whole path of transitioning, or I'll say transition from being a pre-med to nursing, because for those who don't know, if you really want to be a nurse, or if you want to be a nurse, there's multiple ways that you can do it, and that's one of the things I really like about it. So you can either go to a regular program, RN BSN, where you get your RN license. Well, you will get your RN license once the program will be done by you taking the NCLEX, and then you also get a Bachelor of Nursing, which it's gonna be as soon as you'll be done with a degree. So it's usually like a 4-year. I think some programs have like a 3 years program, like a RN BSN program. So you pretty much get to your credentials and also your degree by doing this kind of programs. But you can also try to do a LPN program, which is what I'm currently doing right now, where it's kind of like you being a nurse, but not fully. I'm sorry for what I'm saying right now, because I know LPN are nurses, but it's just like it's kind of like you. I'll say being ahead of. Well, it's pretty hard for me to explain because, I signed up for the program, I got in, but I really didn't talk to a lot of LPNs to kind of have like a good idea of what an LPN RN is. But I just know being an RN is just more responsibilities and more tasks that the LPN that don't necessarily have to do or don't deal with based on wherever they're working at. So the LPN program is usually shorter than the RN program. And they're pretty much like a year program. Some programs have it less than a year, kind of like 12 weeks or 9 weeks. I've seen 9 weeks. That's crazy, but hey, I've seen it. So yeah, so you go through the program and then you take the P NCLEX or LN NCLEX, some kind of, but it's a type of NCLEX. and then you will get your license by doing so, which is pretty good. And it's a year, and you get to do, I'll say, good money, because I'm doing money right now. But based on what I'm gonna be doing in a year after doing this program, it's gonna be good money, to be honest. And I'm living in Florida, so I'll take it. And yeah, so you can either go to the LPN path. So you do your LPN program. It's gonna be a year, and then you can do a transitional program where you're gonna do from LPN to RN, which typically are a year as well. And some hospitals sometimes offer it, but I do know my hospital actually offer a program like this. So I'm gonna try my best to actually get into the program from my hospital as soon as I'll be done with my LPN program. So it's not gonna be like me doing LPN and just being done, but it's kind of like me slowly I'll say going on top or climbing the ladder. That's what I was looking for. It's gonna be me slowly climbing the ladder and do as much as possible with what I have right now, instead of actually going all in and take debt, and given how the economy is, and just be miserable for the rest of my life. I'm not saying that people who has debts are miserable for the rest of their life, but I'm just saying, like, that's how I feel about debt, and that's kind of like one of the toxic mindset, I guess. But hey, right now I'm 21, and I'm hoping to buy a house by the time I'm 25 at least. So I'm trying to be smart with my finances, even if it's not totally smart yet, but thinking ahead. So yeah, you can either do LPN or you do RN, LPN, and then you do the transitional program, which typically is gonna be 2 years, 3.5, or you do your RN BSN, which sometimes it's gonna be, well, it's like 4 years, maybe 3 years. And the way that I plan on doing it is I'm doing my LPN program right now, which will start in August. And after that, while I'm doing my LPN program, I'm currently doing my AA, and I'm done with pretty much doing my AA. But I'm just taking some extra classes because it's a community college and it's like less expensive. So I'm just taking as much as classes I can take, and then I'll transfer to regular university, and then I'll have my bachelor. By doing so, I'm thinking about, like, my AA is done, but I'm still taking some extra credit, which is gonna be under my AA. So as soon as I'll graduate from my LPN program, I'm also gonna get my AA. I'm gonna put a stop to all the classes that I'm taking, and I'll just go do the transitional program from RN, LPN to RN, while I'm double majoring in biomedical engineering and nursing, or maybe double majoring in something like not biology, biomedical engineering or genetics or something else, and nursing, because I'm heavily into the double majoring, because it's gonna be much more easy for me to actually get all them stuff done, and I really don't have to take any time off to get them done. And the classes I'm taking right now, or the classes I used to take as a pre-med, are kind of like similar to the class that I would have taken as a nursing student. So it's just some added classes, and I'll just like take them and get my credentials and also my degree, which is taking a little time, but I know by the time I'm 23 max, I should have my RN BSN and decide what's gonna be the next step after that. So, well, when it comes to next step, it's not really as clear, or it's not really clear right now of what I really want to do as soon as I get my RN BSN. So I'm thinking about, like, either go to NP school and become a nurse practitioner and open my own, like, wound care practice. I know having a wound care practice is something that I really want to do, so I'm gonna try to focus on this as well, or go to CRNA school and become a CRNA and having much more income, which will help me boost my wound care practice as well, or which will help me open my wound care practice with I'll have a much more finances to do so. Therefore, I'm just gonna focus on using my own money and not having to borrow any money to open my practice. Even if I know I'll need to borrow some money at some point, but it's not gonna be as stressful as it would have been, because I know I have the means to get more money, and I actually have a job that is allowing me to get more money. But as for next path, I'll say maybe nurse practitioner school, become an NP, and the kind of NP that I see myself pay right now is being a hospitalist. It's coming back to the whole like in physiology and like in anatomy, and like being a diagnostician kind of things, seeing the patients, getting good history, and having like a idea of what the diagnosis might be, and working with other healthcare professionals like doctors and stuff like that. So I really see myself being NP hospi- NP hospitalist if there's something like this as an NP hospitalist, or CRN is cool, or take a gap year to get my master's, and then heavily think about it. But as of right now, I really don't see anything else, to be honest, that I really want to do with my nursing degree as soon as I get it. But yeah. Well, that's pretty much the end of this video, so I really don't want to say much because I think I've said enough, but I just wanted to make this video to kind of update you guys and show you that it's okay to take a step back and think about what it is you always thought that you want to do, and then choose something else, because it might not be something that you want to do, or just something that you're not able to do right now. But who knows, I just ended up going to med school after I get my nursing degree, which would have been kind of like a twist, but hey, can happen, never really know. But I really don't like the likelihood of this happening is really low, because it's just really low. I don't think so. I think I'll just keep climbing the nursing ladder until I can't anymore, or until there's like nothing for me to pursue, and then that'll be pretty much it, or that'll be the end of it. But I really don't see myself like going to climb another ladder by me being 26 or even me being 30. Nah. But yeah, so just wanted to update you guys. I hope you guys like this video, or I don't know, I'm just putting this out there. Maybe it'll help someone, maybe it'll not, but I just hope it does. If it does help you, if it did help you, just feel free to let me know how you did. And thanks for watching my stuff. I'm gonna try to put stuff out there way much more now, because I work a lot, ironically, but I'm trying to use my time off efficiently. Like right now, I do know that I'm gonna have a 12-hour shift later, right? But I have some time off from the 12-hour shift that I have yesterday, so I can technically take a 25, maybe 20 minutes to just reflect on some stuff and just record a video, which is pretty easy for me to do. So that's what I'm gonna do. And once school will be back on, I'll just vlog a couple days. But as of now, I like way much more sitting. I like sitting down way much more and then talk to you guys like this, like the way that I'm doing it right now. So thanks for watching this again. Don't forget to like, subscribe, and comment if it was something that you enjoyed, and feel free to give me some feedbacks as well, because I'm always open for feedbacks and questions and stuff that will allow me to become a better person. So thank you for everything. Bye.